Welcome to the Mamas of It YouTube channel. This is week 14, I don't have enough fingers for that, of our pregnancy week by week, what to expect. In this series, you're going to learn what to expect, what is going on with your baby, what you need to expect for yourself, and then also how am I feeling in my pregnancy currently. I am in my 4th pregnancy, and I am going through this pregnancy with you. So if you are currently pregnant, be sure to comment below and let us know how you are feeling because we would love to support you throughout your journey. So Roxanne, what is going on during week 14?
All right, week 14. First week of the 2nd trimester, honeymoon. What depends on if you say it's 13 or 14. But we're gonna.
Last week was my.
This is also can be the first week, depending on who you ask, first or second. But regardless, baby is the size of a bagel bite.
A bagel bite?
A bagel bite, or a lemon. I feel like a bagel bite is smaller than a lemon, but maybe I am misremembering. But that's not small.
I can't shove a whole lemon in my mouth. I could put a whole bagel bite in my mouth, though.
If it's a small lemon. A navel orange was another one. I don't know what that means, though.
I feel like navel oranges are pretty big. Anyways.
But I feel like a lemon is also pretty big. So, what's happening for baby? This little bagel bite. Facial muscles are continuing to develop, and they can make facial expressions now. So, you might, if you get an ultrasound during your 14th week, you might catch like a smile or like a funny face, which is kind of cute. Hair is also starting to grow on baby, and not necessarily on the top of their head, but all over their skin. A thin layer of something called lanugo is forming, and this is a protective measure for their skin because they're living in just a bag of water, as well as to keep them nice and warm. Baby's genitals are also fully formed by this point, but you may not be able to see it via ultrasound just yet. You might need to wait a couple more weeks. At 14 weeks with my first baby, I was able to see the genitals on ultrasound and determine the sex of baby, but not everybody's able to see it at that 14 weeks, so giving it until your anatomy scan is usually advised. Baby's lower limbs are also starting to develop and form further, and toenails are even on their feet now. Crazy. Little toenails are in there. Their skin is also starting to thicken, so it's not translucent anymore where you can see the mouth of all of their blood vessels. It's starting to get a little thicker like our skin is now. They're also able to open and close their fists as well as put them in their mouths or kind of move them around a little bit more now. And their taste buds are starting to develop. So they're starting to taste things a little bit, which is kind of cool. All of their major organs are starting to finish that fully developed stage. So you're able to see like a clearer picture when you get an ultrasound, as well as their head and limbs, since they're starting to form. Baby looks more like an actual baby on the ultrasound rather than like a little mermaid.
They're just very tiny.
Yeah, they're just very tiny, little bagel bite human. For you, you're obviously still out of the 2nd trimester, so starting to feel better. Morning sickness for most of us has passed by this point, but you might start noticing round ligament pain because that baby is growing bigger. Your uterus is growing bigger and pulling on those round ligaments, which does not feel great. It's sometimes called lightning crotch, but it is due to a tension within that round ligament pain. You might have some varicose veins too. If you are prone to varicose veins, they might start to develop now during your pregnancy, just from like the increased congestion of the blood flow, as well as the increase in weight from baby growing. So how are you feeling, Gina?
Overall, feeling pretty good. The morning sickness is all gone. All my food aversions are pretty much gone. I haven't really had any foods that I'm like, ugh, or anything, which is really nice. I could eat pretty much normally again, which I really appreciate. I did look at my chart for my prenatal appointment. So I'm planning to give birth at home. So I have a home birth midwife that I'm working with that I do the majority of my prenatal care with, but she doesn't have labs or ultrasound at her clinic. And so I also do dual care with a hospital clinic to get like my labs and ultrasounds. And if I risk out of home birth, because for me, it's not home birth or bust. Like I only want to give birth at home if I'm a good candidate for it. I go to a hospital clinic to have dual care, and so that's where I get all my labs and ultrasounds done. I had my appointment with the hospital midwife about 2 weeks ago when I was like 11 or 12 weeks pregnant, but I looked at my chart recently because I was sending my lab work to my home birth midwife, and on it listed was a problem of advanced maternal age, and that was a little startling for me because the word problem to me says that something's wrong with my pregnancy, even though it probably should just be like additional billing, like advanced maternal age. And so I found myself feeling very anxious about the fact that they were listing this on my chart as like a problem for me. And so we were waiting for our genetic results to come back. I was feeling very anxious about that as well. in addition to feeling like maybe there was more complications with my pregnancy than maybe I was aware of. Fortunately, I was able to have like a really good conversation with my home birth midwife about it, and she reassured me like, hey, like there really aren't any complications in your pregnancy right now. Like you're very healthy for being 36. Like I am not concerned about your age. Like there's a difference between being 36 and not having any complications or coming into your pregnancy with any issues versus being 36 and already having issues with your pregnancy. So one of the risks that could be associated with advanced maternal age, which is a pregnancy past the age of 35, is chromosomal abnormality. So like the baby is not developing well in the early part of pregnancy due to an issue with the chromosomes. And so because I am advanced maternal age, I had additional testing offered to me that was covered by my insurance, which was really cool, I thought. Like there's additional offerings for me throughout my pregnancy, so I have a little bit higher level of care offered if I opt for it. I don't need to opt for it. Which is known as the NIP test. So it's a genetic testing that you can do that is a little bit more like intensive, but it's just a blood test. And everything came back normal for us. So it was really awesome to know that like the pregnancy is doing really well in the beginning of it. But I did find myself feeling a little bit more anxious because I had this like problem listed as advanced maternal age. So that was something that I was kind of dealing with last week of like mentally overcoming that, hey, like I am a healthy 36-year-old. I didn't come into this pregnancy with any medical issues. Like this pregnancy is trending low risk. Like I haven't had complications in prior pregnancies. So this one being advanced maternal age is probably not going to be an issue for me. But I felt really thankful that I was able to have a conversation with my provider on what it may mean for me and what additional options are available to me if my pregnancy does become more complicated because of my age. Outside of that, though, I'm still working out pretty regularly, about 3 to 4 times a week. I'm lifting weights and doing some cardio. I actually did a whole workout, which I was really excited. I did the cardio.
Most people skip the cardio.
So with our prenatal fitness programs, we have like a strength portion. So it's like 2 rounds of strength exercises and then some accessory work. And all of this is focused on keeping you strong throughout your pregnancy, ensuring that you're pain-free throughout your pregnancy. So incorporate a lot of pelvic stability exercises because even at the early part of my second trimester, you can start to experience some pelvic pain as well. So like that pubic symphysis pain or pain to the front of the pelvis or that SI joint pain to the back of the pelvis. And for me, I normally have like SI joint pain during my second trimester. So doing a lot of stuff now to kind of prehab against that, in addition to a lot of like pelvic opening exercises as well. So just doing a lot of different movements to ensure that I have the capability to find different types of movement patterns to create different types of space within my pelvis. And so our prenatal fitness programs, we have this beginning portion that's all like the strength and accessory. That's like the pelvic stability, pelvic opening, strength exercises. And then we have an optional conditioning that you can do afterwards. And I did the whole thing. And I felt really energized to do the whole thing. So look at me, just overachieving here in my pregnancy. Usually I just do the strength and I'm like, I'm good. But
honeymoon phase took Gina over. She did both prep.
But last week I felt really good and I did the whole workout. So we'll see if I do the whole workout again this week or next week when I have 15 weeks. But yeah, so I have loads more energy. Loads, not that much, but a little bit more.
Her sense of smell is also heightened.
Very heightened.
Very common during pregnancy for that. I don't know the exact week it appears, but Gina's got it. She can smell a dirty diaper from across the room.
I can. It's a superpower. I'm very impressed by it.
It's not always a good thing.
So overall, I'm feeling pretty good in my 14th week of pregnancy. Was having a little bit of anxiety about having this thing listed as a problem on my chart. But thanks to some conversations with my midwife, I understood what it actually meant for me as an individual during my pregnancy. So if you're having questions about things that are listed in your chart or potential risks with your pregnancy, because there are like overarching risk factors that we can have, it doesn't necessarily mean that you have an issue going on with your pregnancy. So having conversation with your provider on you as an individual can be really beneficial to help decrease the anxiety that you may be feeling during your pregnancy. We hope you enjoyed this episode on what to expect during your 14th week of pregnancy. There's a lot of development going on with your baby. You're probably feeling really good. You might be starting to experience some of the discomforts associated with pregnancy, just as that round ligament pain or pelvic pain. Hopefully you have some tools to help you navigate this portion of your pregnancy. If you don't, feel free to join our online childbirth education course where we teach you the science of birth and what to expect as you near your due date. and our prenatal fitness program so we can help you stay strong, pain-free as you prepare for birth throughout your pregnancy. So if you want to check those out, you can check them out on our website, and you can use code YouTube10 to get 10% off any of our online offerings. If you bundle our courses together, you save 15%, and then you can add on the additional 10% to save 25% overall. So thank you for watching this episode of what to expect throughout your pregnancy. If you are pregnant, be sure to comment below to let us know how you are feeling during your 14th week of pregnancy, because we would love to connect with you on your journey.